94.7, today's Sunny 95.
Welcome to The Reasons We Smile with Dr. Kvitko, the show that brings you man-on-the-street interviews, celebrity guests, groundbreaking research, and heartwarming stories about the reasons we smile. Our show is also known as everything you've always wanted to know about dentistry, but we're too numb to ask. Hello, I'm General Dentist Dr. Kvitko, and thank you for joining me today.
The following views and opinions do not necessarily reflect those of this station, its staff, management, or parent company. To hear a replay of this show or one of the great shows that previously aired, log on to thereasonswesmile.com or iTunes, keyword Dr. Kvitko or The Reasons We Smile. Listeners should not use Dr. Kvitko's comments and advice in place of an actual dental exam.
Brighten your life with a smile that shows the professional touch of Dr. Kvitko.
Time now for The Reasons We Smile with Dr. Kvitko. Call 459-9769 to discuss your dental issues. Now, here's your host, Dr. Kvitko.
Hello, everyone. Welcome to The Reasons We Smile. I'm Dr. Kvitko. This is episode number 573. I want to thank you for joining me. I really appreciate it. I think we're going to have a great show today. With us in the studio is Health Commissioner of the Franklin County Health Commissioner, Joe Mazzola. So thanks for joining us. We'll bring him on in just a second. I'm going to introduce him. Before we get started, let me remind you, if you'd like to follow me on Twitter, it's at Dr. Kvitko. And if you'd please go to my office Facebook page and like us, that would be awesome. All past episodes, complete with video, are available at thereasonswesmile.com. And we are streaming live on Facebook. And if you happen to be looking at Facebook, you're going to see Joe Mazzola, not me. I tried to get us both on camera, but the studio just won't allow that. It's either or. So your friends can watch, Joe. Okay, so let me just introduce Joe. I'm going to read you his bio. As I mentioned, he is the Franklin County Health Commissioner. He has a master's in public administration. Is that correct?
That's correct.
Right. He has served as the Director of Health Systems and Planning at Franklin County Public Health prior to joining the department. He worked at the Ohio Department of Health, where he held a variety of positions, including local health department liaison. Before working for the Ohio Department of Health, Mr. Mazzola served as the policy and government liaison for the Ohio Tobacco Prevention Foundation and a regional policy coordinator at the American Lung Association. I think you have to have a talk with my producer when we go off the air. he realizes that somebody made a New Year's resolution and not smoke anymore, and I think there's a thing of Marlboro right there. Am I right? Yeah. He's looking for them. Where'd they go? I didn't steal them. Anyway. All right, so in addition to being Franklin County's Health Commissioner, Mr. Mazzola serves as at-large member of the Governing Council of the Ohio Public Health Association and chair of the Shared Services Subcommittee of the Public Health in the 21st Century with the Ohio Public Health Partnership. He is a recipient of the Association of Ohio Health Commissioners President's Award winner in 2015, past president of the Association of State and Territorial Local Health Liaison Officials, and was a lead contributor to the Public Health Quality Indicators Report in 2015. As I mentioned, he has a master's degree in public administration with a concentration in public health from Kent State University and a bachelor's of arts degree in marketing from Marietta College. Welcome.
Well, thank you. Thank you so much for inviting me.
And by the way, is that Marietta in Ohio or Georgia?
Marietta, Ohio.
Ohio. Okay, so you're an Ohio guy. And I noticed that your cell phone number starts with 216, which means you're from Cleveland, that area.
I am.
So where are you from?
I grew up in Garfield Heights, right outside of Cleveland.
Cool, and I grew up in Twinsburg, Ohio. Oh, I just lost the volume for the Facebook feed. Anyway, so that's pretty cool. Now, you mentioned off the air that you're a twin.
I am a twin.
Okay.
I am a twin. So when you
twin
mentioned
brother or
Twinsburg,
sister?
I am a twin brother,
Okay.
and then I have older twin sisters. And I have two younger sisters as well who are not twins, but we have
6
two sets
kids?
of twins in our family.
Oh my goodness. Your parents were probably shocked when the second round came along, weren't they?
I think so.
That's pretty cool. I always thought it'd be neat to be a twin. Is it neat?
It is very neat. It's wonderful to have a sibling so close, and then of course I have my other siblings as well. So we have a great family.
Awesome. That sounds great. Okay, so we have some questions, some things I want to get to really quick. So now when I hear the word commissioner, I think of Commissioner Gordon in the Batman series. And Commissioner Gordon is the police commissioner, right? And I believe you're kind of like the health police. Are you the health police? Making sure we're all being healthy?
Well, I wouldn't say that, but we do have some obligations as a public health department. So as the health commissioner, it's my job really to oversee the day-to-day operations of Franklin County Public Health.
Okay.
And Franklin County Public Health is one of 2 health departments in Franklin County. We are a general health department, a general health district.
Okay.
So we provide public health services to our townships and villages,
Okay.
as well as 14 other cities in Franklin County.
Okay, now I know Columbus has their own, Dr. Mashika Roberts. So does she report to you, or do you work side by side, or how does that work? Do you
We're
only
peers.
Your
We are
peers. Do you only
yes.
serve the cities outside of Columbus that are in Franklin County?
That's correct.
Okay.
So the villages, townships, and then 14 cities outside of Columbus, and the cities of Worthington as well, which is served by Columbus Public Health.
Okay, got it. So see, I wanted to figure that out. I'm very curious. Can you tell? So how does one become a health commissioner? I mean, you're not a doctor. She is. I guess it's not a requirement.
It is not a requirement. So
Okay.
in the state of Ohio, for general health districts, you can be a physician, but if you're not, you can also have a master's degree in a related field.
Well, I'm not saying you don't do a great job. You're probably awesome at it. You don't have that other stuff dragging at you. But no, I just thought it was interesting that
Yeah.
you could be a non-physician and you could be a physician and still have the job.
Yeah, that law changed about 30 years ago, where a health commissioner can be a master's prepared professional,
Okay.
and there's public health, public administration, another related field. And for me, as you read it, and I appreciate that introduction. It's been a really great journey in public health, starting in tobacco control, working at the state level, and then now with Franklin County Public Health.
Cool. Very cool. Now, what is your primary message to the people of Franklin County? Is it get your flu shot, or are there others?
Well, it depends on the time of year. Certainly, number one right now is get your flu shot. Absolutely.
Okay, so here you have the microphone. You can tell everybody get your flu shot.
Yes, it is. We are seeing flu activity increase in Franklin County in the state of Ohio. So it is a great time to reiterate that message to get your flu shot. To continue to use good hygiene, obviously washing your hands, covering your cough, etc., staying home when you're sick. And so we know flu season is going to be here every year, and so
Yeah.
those are just some core messages for as we kind of get into that more active flu season.
Now, I think it was Dr. Teresa Long that was the city commissioner,
Mm-hmm.
health commissioner before Dr. Mashika Roberts. And she would not shake hands. She wouldn't even do a fist bump. She did the elbow bump. What do you do?
Right. I try to do the elbow bump during
You do
flu
the elbow
season.
bump?
Absolutely. Yeah. and folks shouldn't be bashful about doing that.
Okay.
It definitely helps.
So you don't even like the fist bump either?
Well, yeah, not during flu season. Sure.
How about a kiss on the cheek?
No.
Okay. So now, all right. So now what would you say is the, oh, I know. Okay. I think this is kind of funny. Okay. Since your job is to encourage everyone in Franklin County to live a healthier life, would that be true, right?
That would be true.
Do you find yourself afraid to eat unhealthy foods in public, like say at elephant ears at the fair? Do you have to really watch what you do?
I try to set a good example. I try very hard to set a good example, mostly for my kids, but certainly for the community. But there may have been an elephant ear in the past at some point, but really try to make sure that we instill good healthy eating habits.
Okay, so you practice what you preach.
Absolutely.
You're not really a closet junk food eater.
No.
You don't go into the closet and eat junk food. Okay. Well, that's cool. Now, I understand that you guys did some kind of a massive, what'd you call it? Franklin County Health completed a Franklin County Community Health Improvement Plan in 2018.
We did.
So tell me about that, and most importantly, where did the dentistry come up?
Yeah, sure. So about a year ago, we completed our 2017 community health assessment, and then as we got into 2018, we went into the planning, planning implementation of how can we address some of the health disparities and some of the more significant health factors in our community that we found in that community health assessment. So we put together a group that we call HealthWorks Franklin County.
Okay.
And HealthWorks Franklin County is a group of about 80 to 90 organizations that have come together and have really looked at how we can collectively and comprehensively improve the health of our community. That has a focus on social determinants of health, which we can talk about here in a minute.
Right.
But it's a great coalition of organizations that looked at that community health assessment, identified some priority areas, and then also identified some strategies to address those priorities. And in that conversation, access to healthcare came up time and time again.
Okay.
And then specifically, as we looked at access to healthcare, dental came up as well. So that was kind of the one of the main areas that, as those organizations talked about, the needs of our community, dental care came up quite a bit.
Okay. And so it is one of the areas that was identified as we have a need that has to be filled.
We
right?
do. field.
Now, I'm a member of the Medical Reserve Corps, so at Franklin County, so is my wife. I almost brought my ID badge to prove it. Do you have one of those? Oh,
I do have one of those. Yeah.
Yeah. And I also have done several, I think 7 years, dentistry from the heart, where we open up the office and give free dental care to hundreds and hundreds of people. And I have a motorhome that's 52 feet, and I'm still making payments on it, by the way, but I bought portable dental equipment so I can go out. We did a thing at the Arts Complex, King Arts Complex, called the Living Smart Workshop, where we set up and did free dental care for that. And we do, we did a back-to-school event at the East North Broadway Methodist Church. Back-to-school dental exams, things like that for children. A lot of times it's immigrant children. Those parents, the language barrier was pretty strong that day. But it was kind of nice to do, and there is so much more that needs to be done, would you say?
I would agree, absolutely. And we are very thankful for those safety net providers and other organizations that are providing that care in our other community base. We have community health centers that provide excellent dental care as well. So, during that community health planning process, we did recognize that there are resources and there are organizations that are willing and are stepping up to provide, health care, particularly dental care for those most vulnerable populations. And so, but the need does continue.
And we'll talk a little bit more about that when we come back. But what we're going to do now, folks, is we're going to do Dr. Kvitko's question of the day. I forgot to mention earlier in the show that you're going to have a chance to win free flowers from DeSantis Florist. The number is going to be 614-459-9769, so you can set your pre-program your phone to that to be ready. Before we do the contest, though, we'd like you to listen to this.
This station will not be held liable for any contesting during The Reasons We Smile with Dr. Kvitko. Participation in the contest allows Dr. Kvitko to record and broadcast your name and call. One winner per household. Prizes are non-transferable, cannot be substituted, and are subject to taxes and fees. This station cannot be responsible for the inability to enter the contest, whether due to equipment malfunction or telephone difficulties. All decisions of Dr. Kvitko concerning this contest or eligibility are final.
And now it's time for Dr. Kvitko's question of the day.
All right, and as you know, in the studio with me is Franklin County Health Commissioner Joe Mazzola. And we just talked about the fact that they did this study. So a need for better oral health and more dental care was one of the priority needs. Oh, it's true or false? A need for better oral health and more dental care was one of the priority needs identified by the Franklin County Community Health Improvement Plan in 2018. Is that true or is that false? All right, the winner's going to receive free flowers from DeSantis Florist. They'll be delivered to your place of business this Tuesday afternoon. The number to call is 614-459-9769. That's 614-459-9769. So go ahead and call now.
You won't believe it though. I wanna hear your mind. And there's nothing else in the world tonight. She said, people don't take the time. Hey, people don't take the time.
Hi, I'm Keith Carlos, winner of America's Next Top Model and star of Chocolate City 2. Look for my smile on the big screen this summer, courtesy of Dr. Kvitko. Stay tuned to The Reasons We Smile with Dr. Kvitko, the world's most interesting dentist.
Hi, I'm Dr. Kvitko, general dentist and host of The Reasons We Smile radio and roadshow. Did you know that you no longer need to visit several different dental professionals to get more complete dental care? We handle everything from cleanings and orthodontics to restoration, implants, and smile makeovers, all in my office. And now we have 2 locations. Get the most advanced technology and procedures available today. It's more complete dentistry.
Visit worldsmostinterestingdentist.com for more info about Dr. Kvitko.
Dr. Kvitko, let's go!
Hi, this is Richard Simmons. Dr. Kvitko's here, and he's going to help you with all of your problems. Are your teeth yellow? He can fix that. Are you missing a tooth? He can put a new one in. How is that?
That's very good. Thank you, Richard. All right, we're back. We're doing Dr. Kvitko's question of the day, and our winner today is Sarah. Hey, Sarah, how are you? At least I was told you had the right answer. What's the right answer?
It's true.
True, that's right. Okay, well, hey, Sarah, stay on the line. We need to get the information of where to send you those flowers. We appreciate you listening. We really do. And thank you so much for calling, okay?
And I got the first flowers of the new year.
Oh, that's right. She did. And you bring up a good point. This is my first show of the next 12 years. So anyway, okay, well, you hang on, Sarah. Thanks so much.
Thank you, Dr. Kvitko.
You're welcome. All right, so if you're just joining us, in the studio with me is Joe Mazzola. He is the Franklin County Health Commissioner. Been that since December of 17, so you have a year now in the job, right?
Actually, 2 years.
Oh, 2 years in the job.
Mm-hmm.
Okay, before 17 then.
I started January of 2017.
January of 17. Okay, my apologies.
Yeah.
Okay, so, and we're just getting around to having you on the show. It took me so long, huh? Okay, so now, besides the dental, what other health areas were identified that need to be prioritized, that are a big thing?
Sure. So in our community health improvement plan, we identified 4 priority areas. The one was that we just talked about was access to care, which included the dental piece. Chronic disease was another one, particularly diabetes, hypertension, and obesity.
Right.
That actually was the first one that we all recognized as a real need in our community. Maternal and infant health was another. We know we have a lot of effort and initiatives happening in Franklin County regarding infant mortality, and that work continues to try to reduce our infant mortality rates here in Franklin County. But we're also really focused on improving our vaccination rates as well for our infants in particular.
Okay.
Mm-hmm.
Now, you have to combat this notion that vaccines are bad, people are out there saying vaccines cause autism and stuff like that. Do you have a program to specifically address that, or is it just all just trying to hammer the notion that vaccines are safe, we need to have people vaccinated, even if it's just for the people that can't take the vaccine because of an allergy to them, right?
Sure, absolutely. Yeah, and we talk a lot about the safety of vaccines every day. We have an immunization program where we provide immunizations across Franklin County on a regular basis.
Right.
And then we also have a program where we engage physician organizations and healthcare providers to work with their staff and improve the communication with them so that they can continue to re-emphasize that message with their patients as well.
Okay. Because and I remember when we were doing the H1N1 vaccine, that was one of the major ones I was involved in with the Medical Reserve Corps, and we got a lot of questions about that. Okay. So, now, we said before the break we're going to talk about access to care. And, as many people and there was a point where I think I counted that in 4 or 5 years I'd helped be responsible for about 3,000 people receiving free dental care. Sounds like a big number till you really understand it's a tiny drop in the bucket for what the need is out there. So what % of people do you think that actually are in need of this dental care are actually getting it? I mean, you have programs, I did some things, some other dentists do some things, but we're missing 95% of the need, would you say?
So we actually don't know the specific number, but we do know that it's significant.
Okay.
And so what we've done in response to our community health improvement plan and particularly the issue of oral health care is that we've convened a group of organizations, which include university partners, private practice, our payers who do pay for.
You got the insurance companies
We have the insurance
involved?
companies at the table. And so we've convened that group to talk about, what is the unmet need? How significant is it? What are some of the strategies that we can be doing to make sure that we can connect resources that are available, like you talked about earlier, with those who are in need? And so we're trying to put together a coordinated, comprehensive strategy, but that first starts with data. And so we've engaged the State Health Department, which has some data related to the unmet need regarding healthcare. And so we're starting there. We have the right organizations around the table, and we're going to be putting together a comprehensive strategy to move forward so that we can really start to improve those rates and access to healthcare.
Okay. Well, that's good to know that you're out there doing that, and people are going to benefit from it. Before we go to the break, I'm going to ask the question. You can ponder your answer, and then we'll come back with your answer. So, why is it, in your opinion, that our system of healthcare and health insurance takes away a person's dental insurance when they reach retirement age? And it seems like that's at a time in their life when they need it the most, and yet they have no insurance benefits to obtain it. So we're going to go to a break. You weren't prepared for that question, but I'm sure you have a good answer coming up. You're listening to The Reasons We Smile, episode number 573, and we'll be right back.
You can take me as I am, not just a little bit. I don't know who to be. I'm a paper cup, baby, of the sea. I know you see it too, 'cause you're too much for me.
This is Clark Kellogg. Stay tuned for more of Dr. Kvitko.
Estás escuchando con Dr. Kvitko aquí en su estación favorita.
Hi, I'm Dominique Reichert. Like what you hear? Why not use the show to promote your product or service by becoming a sponsor? Call 614-262-9588 to learn how. That's 614-262-9588. Call now.
Hi, I'm Dr. Kvitko, general dentist and host of the Reasons We Smile radio and roadshow. I've been honored to help several famous people get a perfect smile, like Keith Carlos and Dominique Reigard from America's Next Top Model, and Ted the Golden Voice Williams from right here in Columbus. Isn't it time you had a celebrity smile? It costs less than you might think, and most of the time, it can be done in one visit. A new smile can make a world of difference.
Visit worldsmostinterestingdentist.com for more info about Dr. Kvitko.
I'm Grandpa, and I go to Dr. Kvitko, and I still have all my teeth. Real ones. Where's my glasses?
If you're just joining us, I'm Dr. Kvitko. With us in the studio is Franklin County Health Commissioner Joe Mazzola. And before the break, I posed a question to you about why people seem to lose their dental insurance at retirement age. So what would your response be? What do you think about that?
Well, it's troubling to hear that. I wasn't aware of that. As we were talking earlier, one of the things that we're trying to address is, collectively, how can we improve access to dental care in our community? And so our focus was originally particularly our youth, but the question that you posed really has given me some reason to go back and say, okay, are we making sure that we're addressing our entire community? And so when individuals lose coverage, whether the example that you cited or otherwise, it becomes a barrier. And so, we want to reduce those barriers to care. And so I'll make sure I take that back.
That's awesome. So it sounds like I asked the right guy. We'll see what we can find out. And maybe, let me know. You have my cell phone number, my email address. Okay, so what do you think? Well, I wanted to mention this too. So if people have questions about their health or about accessing medical or dental care, can they call your office? How does that work? Are you a resource for them, or?
So we have a lot of information about public health issues, obviously, on our website. And our website is www.myfcph.org. So myfcph.org.
Franklin County Health. Got it. So say it one more time since I interrupted you.
Sure. www.myfcph.org.
Okay. There's no dot after the www?
www.myfcph.org.
There is a dot.
Yeah.
Okay. I think you left the dot out. www.myfcph.org. FCPH. Okay, got it.
On our website, we have a lot of information about public health topics. And so individuals can go to that website, find some information, not only about the public health impact, but then depending on the issue, there'll be resources as well as far as, where they could potentially find, whether it's a provider or other information that they might need.
Okay. So, if you could snap your fingers and make everything okay for one of the health-related issues our people are facing today, which aspect of the health and wellness of our citizens would you choose?
Without a doubt, it would be tobacco.
Tobacco
use. It's one of those issues that our society has frankly struggled with for decades now. We're coming up, actually later this week, we're coming up on the 55th anniversary of the original Surgeon General's report.
Wow.
That really brought it to our attention in terms of the impact that it has on our health. We at the health department have a grant funded by the state of Ohio to provide free tobacco cessation to any Franklin County resident.
Really?
Free of charge. And
you don't have to show need?
They don't have to show need. We will bill your insurance company, but if you don't have insurance, we will pick up the remaining costs to provide evidence-based tobacco cessation to any Franklin County resident.
Hear that, Mr. Producer? It's free.
Well,
yeah, I hear. It's free. It's some money to kick. I know.
And
I promise.
Okay.
I made a promise to myself, and I mean, I bought like the patches that you can get from the store. It's worked the first time, but I had some bad stuff happen, so I fell back into the bad habit. So we're back to. I've been sick the past week, and I woke up in one day, and I was like.
So here's the thing about tobacco is that it, like many addictions, it takes several times.
More than once, yeah.
And on average, it'll probably take 7 to 10 to 12.
Yeah, I think I'm on 4 right now.
So our message is keep trying,
and
that we will, we certainly have resources to help individuals do that. But tobacco is one of those issues that has such a huge public health impact. More than 450,000 people die every year of tobacco-related illnesses across this country. We have a prevalence rate in Franklin County that continues to be higher than what we want in terms of the national average and our Healthy People 2020 goals. So, if you make me pick one, it would be tobacco.
Okay. And I was going to give you a chance to pick 2. The next question is, what would be your second worst?
So, as we look at our community health improvement plan. Chronic disease, obesity, diabetes, hypertension would probably be my I probably group those together.
Okay.
Mm-hmm.
All right. So let's see now. When it comes to dental care and oral health, what is the message that you would like every citizen of Franklin County to know?
Really, that it's such an important part of your overall health.
Right.
And as you speak to better than anyone, if you're not receiving proper dental care, regular dental care, your overall health is going to be impacted, and so it, whether it, and that goes not just between the 2 visits, but then also what you're doing in between those 2 visits every year. Are you eating properly? Those sugar-sweetened beverages that maybe would impact, not only your cavities but your overall health. So that would be my message. That it really is so important for your overall health.
Right, and not taking care of your teeth and gums can kill you. Literally can kill you.
It can.
It can give you congestive heart failure if you have all this infection circulating through your body. My wife and I watch the archaeology channel a lot, history, and you'll see that Egyptian mummies, oftentimes you'll see that they died of a tooth abscess. They find out that's what killed them. And I had one patient walking around with 5 different dental abscesses, but they weren't hurting. So they weren't doing anything about it. But all that pus is just going through your blood. Right. Every time it passes through, it has a chance to damage your heart valves, and essentially kill you. So it's very important, folks, that you remember that your health is related, your dental health and your health is related to your oral health. They are connected. I had a gentleman die of congestive heart failure because he didn't have the periodontal disease handled. Within, I saw him maybe 6 months after I first said, you have gum disease, we need to do surgery. What did he say? I don't have dental insurance. So he didn't go. And when I saw him 6 months later, he had to stop and catch his breath after 1 step. I had 2 steps at the front of my door back then. I have none now, by the way. But anyway, he had to stop and catch his breath after each step. And he was gone within 8 months from the first time I said that. And he was very vigorous and healthy when I first saw him. So anyway, it's very, very important, and we appreciate what you guys are doing at the Franklin County Health Department. And I'll continue to do my part as I can with the Medical Reserve Corps. Sometimes I can't do the call-down drill. I just can't go and leave my office, during the day to help with maybe a rabies vaccine or something with some pets, which is still very honorable. My daughter's a vet, by the way. But when there's a real need, I will close my office and be there if I can.
Well, we really appreciate your participation in the Medical Reserve Corps program. It's one of our programs that we're really, really proud of. But as you mentioned, there's a lot of programs and services at the health department, and so we would just encourage
people that
contact us,
see what's available,
and really take advantage of those resources. We want to make sure that we provide services to those who need them, and so I did bring a folder with me. I'm happy to leave it here with you.
Okay.
And so if there's anything we can do at Franklin County Public Health, please let us know.
Awesome. Thank you so much, Joe. All right, that's all the time we have today. Don't forget to follow me on Twitter at Dr. Kvitko and visit my office Facebook page and like us. Remember, all past episodes, complete with video, are available at thereasonswesmile.com. Be sure to tune in next week and every week right here on your favorite station. Goodbye.
Carly Red from Love and Hip Hop Atlanta, the hit show on VH1, urging you to tune in next week with my dentist, Dr. Kvitko.
If you're interested in learning more about this and other dental health topics, go to thereasonswesmile.com to access full episodes of Dr. Kvitko's show.
If you'd like Dr. Kvitko, the world's most interesting dentist, to speak at your next event, please call 614-262-9588. That's 614-262-9588, or send an email to speaking@thereasonswesmile.com.
WSNY FM. WSNY.